when you talk about punches, this is where we talk about the size of the punches. It can be 0.7 mm, 0.65 mm, 1.1 mm. So this is the size of the punch. And normally, to know the height, we actually do the harvesting, we extract the graft, and then we measure the length of the follicle, and therefore we can adjust this. You can just turn this and you can adjust the length so that the grafts comes out very smoothly. Just score and guide this whole the whole punch inside. And this is how you do the every patient has a different setting, depends on how deep is the follicle or the angle of the follicles, and also the type of the skin, you know, whether it's a surface skin or it's a hard skin, and we will monitor it. And then most patients ask me, doctor, how do you know how many grafts will you have harvested? How do I know? If you say 4,000, how am I going to know that I've got 4,000? Simple. During lunch hour, we show to all our patients the number of grafts we actually have harvested. So in order for this punch to rotate and move, and this will be the area that is a pedaling that we have to, if you look at it now, I'm going to show this, I'm going to show this moving. If you press here, yes, there's a sound, yeah, and you see this moves, so the number has gone up. So another sample, look at here, it will change from the green to the yellow color, and the number will increase here. At same time, my foot pedaling is that you can do continuously or you can do individually, depends on how experienced is the doctor. This is moving, and that's it. Sometimes as time goes by, you have to change the in here at our clinic, we change the punches following on the size, because when you come in right in the occipital area and the parietal area, the caliber, the diameter, the caliber of the follicles are different. So you may have 0.95 at the center as the occipital area, and then as you move laterally to the parietal area, you may have to change it to 0.65 or 0.7 mm. This is what we do in our clinic. We have different sizes and punches, and also we get ready 2 or 3 PCID ready for our clinic here. So this is how the PCID works in our clinic, and most patients do ask us the questions of how do I know how many grafts I've harvested. Thank you so much.